Hello, I'm Dr. Patrice Little here at NP Student Mag, where we're keeping you updated with every aspect of your life in and out of school. Today, we are talking leveraging your influence as a practitioner with Dr. Jonathan Llamas from Los Angeles, California. Welcome, Jonathan. How are you?
I'm doing well, Dr. Little. How are you doing today?
I am so excited that you are here, and let's get started. Can you tell us about you as a nurse?
Sure. Well, again, like what you mentioned, my name is Dr. Jonathan Llamas. I'm a board certified psychiatric mental health nurse practitioner, and I currently work at a outpatient private practice setting here in Pasadena, California. Prior to me working in my role, I graduated with my Doctor of Nursing practice at Loma Linda University in 2019. And prior to that, I worked as a registered nurse for approximately 6 years. I worked in a variety of different settings, from the ER to the ICU, but most predominantly in the acute inpatient psychiatric setting, where I mostly dealt with adult populations dealing with a variety of mental health disorders.
And you have such an impressive resume, I might add. The
Thank
thing that stood out the most, you're welcome, is that while doing all of this, you also have other unique gifts and talents that you have used to encourage many people. And I wanted to know, who is your biggest influencer?
Well, in regards to, I guess, biggest influencer, when I first started my platform at Instagram, it wasn't one of those things where I had the idea of wanting to become big. I just really wanted to have my story being told and hopefully share a little bit about my life and my journey becoming a mental health provider. But in regards to my biggest influencer right now, I guess I would have to say it would be a mixture of a lot of different people. I've been very fortunate to have been able to connect and network with a lot of great providers such as yourself. I've also gotten a chance to connect with the Psych Dude or Life of a Psych NP, as well as Dr. Kojo Sarfro as well. So I guess it's an amalgamation of different people. But again, I'm just very fortunate and blessed to have met with a lot of great people like yourself and like the other two that I mentioned, who's continued to inspire me and to push me to keep going and to share my story.
I agree with you. You mentioned that it's a mixture of different people, and you're absolutely right. Part of being great is allowing different people with different backgrounds to kind of speak into your life and then influence you, and it makes you well rounded. In
I
fact, you're also grounded. So, can you tell us a little bit about what do you do to keep yourself so grounded and to focus on what matters the most?
I think for me personally, I would consider myself very blessed and privileged and lucky to be have been raised by such an amazing family and parents. Growing up, they've always instilled in me the importance of faith and always believing and trusting that God has created me and everyone else around me for a purpose. And I think having that understanding that, again, I'm in a very unique and privileged position to be able to help others who are suffering from various mental health disorders and to not take that responsibility lightly. I think that's one of the things that's definitely kept me grounded, is knowing that, again, God has given me the opportunity to be able to help those in need suffering from various mental health disorders. So I try my best to really use that as a way to motivate me and inspire me to keep going and to provide the best care that I can for my patients.
Now, let's talk. You mentioned about servicing those with mental health disorders. Let's
Mhm.
talk a day in the life of a board certified psychiatric mental health practitioner. Tell
Mhm.
us, what is it like?
Well, I guess it would just vary depending on where you're working. So for me, I can only speak on my experience working in the more in the outpatient private practice setting. But I guess my day kind of varies depending on what is kind of thrown at me that day. So in regards to my current role, I deal with mostly the adult population. So thankfully, in the private practice outpatient setting, they're less acute, meaning that they're a little bit more stable. So my day kind of consists of having a variety of different appointments. So if I have a patient who's brand new and I've never met them before, it's considered a new evaluation. So I have an hour to kind of speak with them, get to know them a little bit better, to kind of assess, diagnose, evaluate, and then kind of conceptualize and implement a treatment plan for them. And that pretty much is what I normally do whenever I see a new patient. And then on top of that, I would also have various follow-up appointments as well. So these are normally patients where I've already established some sort of rapport and relationship with them, and it's kind of a way for me to kind of see how they're progressing in their treatment plan, if I need to make any other medication adjustments or dosage titrations to hopefully get them to where they want to be, and then also provide additional referrals in case they need various cognitive behavioral therapy or psychotherapy services. I go ahead and provide that as well. And then in addition to that, of course, I have a lot of administrative duties. I have various meetings that I go through throughout the day. And on top of that, I also do a lot of other things. Sometimes patients need me to fill out disability forms for them. Maybe patients need me to fill out sick leave or letters for them or other things. So that's what my day normally consists of, having a combination of all those things that I've listed.
So it sounds like you provide an array of services. It sounds like if there's a things from an intake, from establishing rapport and initiating treatment, as well as follow up and evaluation. Do you get to discharge any from mental health services at all who basically are able to cope, moving like to cope?
So again, in regards to what I normally do, it's on an outpatient basis. So depending on their acuity and their severity level, I pretty much dictate how often I choose to see them. So the follow-ups can vary between, if I need to see them sooner, I can see them 1 week or 2 weeks at a time. If I feel like they're relatively stable on their medications and they're doing really well, then I can kind of extend the time that I see them to either a month or 2 or 3 months at a time. So it just varies. If I find a patient is doing extremely well and they feel like they've gotten all that they feel like they don't need any medications anymore, maybe their symptoms is pretty much controlled and stabilized on just psychotherapy alone, and they feel like they no longer need medications, then we can kind of talk about maybe terminating our treatment together, and then just hopefully having them be where they want to be. So that's always very exciting, to be able to hopefully help them regain that sense of stability in their life. And hopefully, maybe they don't need medications as much. And that's always a great thing for me. But like I said, it just varies depending on the individual and their circumstance.
I like that you mentioned that. I had an opportunity to speak with another psychiatric mental health practitioner, and she mentioned the importance of that individualized care. And it sounds like you do the same. So there is definitely a theme when it comes to people who are practitioners. What makes us very unique is that it's always about that holistic, individualized care. Nothing is cookie cutter.
I
Now,
agree.
one of the things that I know many people want to know, because I want to know, even though I think I may know the answer, do you feel that we have arrived with like, we're talking more about mental health as a society? There are more practitioners who are more available. Do you feel like we've arrived to the point where we do not need to bring awareness anymore?
That's a very good question. And I feel like as a society as a whole, I think we've made such great progress as to increasing the awareness of mental health and the importance of having those conversations, right? Making people feel normalized in regards to people who are suffering from a variety of different mental health disorders. But with that being said, I do feel like we still have a long way to go, unfortunately, in regards to continuing to normalize and destigmatize mental illness as a whole. I believe for right now, with the advent of social media, a lot of specific types of mental health disorders are shedding more light as opposed to others. So, for example, depression and anxiety, I feel like a lot of people have definitely felt normalized to talk a little bit about depression and anxiety. But the other mental health disorders, such as bipolar disorder, schizophrenia, schizoaffective disorders, I still feel we still have some progress that needs to be made in that regard. I still feel like there's still a lot of stigma surrounding those specific type of mental health disorders. So it's one of those things where I feel like, even though we've definitely made some great progress, we still have a lot of work to do, in my opinion, to hopefully make other people feel normal as well. I'll just give a brief story. I had a patient who came in. She met all the diagnostic criteria of having bipolar disorder, but when I've kind of explained to her that that's what I believe that's what she has, she was extremely adamant that, no, I only have depression, I only have anxiety. And I think, again, that kind of stems with the fact that there's still a lot of stigma, or there's still a lot of unknowns about what bipolar disorder is, or example, schizophrenia. People think that they're going to be labeled as crazy, and so there's a lot of education that still needs to be done in regards to that.
I agree. That's why we're here today having this conversation, to still continue for the continuity and the awareness that we can need to continue to talk about it. And for those who are comfortable, encourage them to share their story. And because usually people become liberated when they hear that you've been liberated, right?
Exactly.
So I just really, I'm grateful to have you and to talk about that. Now, what do you think every NP should know when it comes to caring for those with mental health conditions?
I think for every NP, what they should know in regarding treating patients with mental health disorder is like what you mentioned previously. It's not a cookie cutter process. It's very individualized, and we have to be flexible and understanding that every situation is different. So even though their circumstances or their symptoms might be very similar, it doesn't necessarily mean that their outcome or their progress to treatment is going to be the same, right? And so the great thing about being educated in the nursing model is that we have a very holistic approach to things. We were very educated on the importance of looking at patients in a holistic way, and to not just look at them as what they have in terms of their disease process, but to also take a lot of things into consideration, and then to let that guide our actions in regards to our medication as well as our treatment, and go from there. So I think empathy is very important, especially in mental health, treating patients with mental health, because again, oftentimes I've worked with, unfortunately, some providers who maybe they're just concerned with prescribing whatever medication they believe would help the patient. But I believe that for patients with suffering from mental disorder, compassion, empathy, and patience are definitely three important virtues that I feel every great provider must have. Because like I said, it does take time sometimes, especially with mental health disorders. It's not something that gets treated right away. It doesn't happen overnight. So having that patience and that empathy is definitely going to take someone far in regards to hopefully getting them to a better place.
Wow. Again, compassion,
Mhm.
empathy, and patience.
Yeah,
The three virtues. If people could have those,
exactly.
it
It's
will
not
help them.
easy.
Yes, I definitely received that, and will, for myself, will try to be intentional, more intentional
Mhm.
about that,
Mhm.
because at the end of the day, it's like some of those patients, when they come to us,
Mhm.
we don't know if they'll ever come back, even though we establish rapport, even though they have a follow-up. And it's so important that in our presence they feel that they're that it's a safe space. And we do that by showing compassion and then being patient with them, that because with time they'll eventually open up. And we covered a lot today, and I just wanted to also highlight a fun fact about you that I learned. And even though at first I'm like, I'm not going to talk about it, but I just wanted to see if you were just open to talking about just your background with like music, because you have a beautiful voice.
Oh, thank you.
So how does what's the role that music has played in you being this amazing person?
Well, well, thank you so much for that. I mean, a lot of people, well, some people who only know me in my professional capacity, maybe they're not aware about my musical upbringing, but music has definitely played an instrumental role in my life growing up. My mom was definitely someone who's inspired me in regards to my musical upbringing. I was, in choir when I was a kid, and I was very fortunate to be able to have performed in different locations in LA. As a choir member, we were performed in the LA Opera House, we performed at the Hollywood Bowl, and we got to travel around the world. So growing up in music, and having that kind of sense of appreciation has definitely helped me to get to where I am, in a sense of I've having that creative kind of upbringing has definitely I think made me feel a little bit more well-rounded as a person. And music is one of those things where I feel is very universal. So it's one of those things where I feel like, even though we come from different places and different backgrounds, but music is one of those things that definitely unites us. And I think as a person, for me, it's also one of those things where I find respite in. Music has definitely been very healing for me. Growing up, when I had difficult times, difficult moments, getting a chance to play the guitar, writing my own music, and being able to kind of express myself in that form was always very cathartic for me. So music again is one of those things where I still love till this day. Unfortunately, I don't get a chance to do it as much now, just because my life now is dedicated to helping others, being as a provider. But again, it's one of those things where I definitely am very appreciative of.
And I am appreciative to be able to that you share that with us, that you allow us to have access to that unique part of you. Well, Dr. Llamas, again, we were delighted to have you here. We hope to have you again. And viewers, we hope that you were inspired by what Dr. Llamas had to say. And how can they get in touch with you if they wanted to, for more inspiration or just to see what's going on with you in your life as a practitioner?
Sure. Well, they can definitely reach out to me on my Instagram. It's my username is John V Raphael, so it's JON V as in victory, and then RAPHAEL. So that's definitely my Instagram page. I use that as my main social media profile and platform, so they can definitely reach out to me and hopefully follow me along on my journey, continuing to spread the importance of mental health awareness and hopefully provide some inspiration and hopefully some unique perspectives as to my role as a provider.
Thank you again for joining us here at NP Student Mag, the definitive voice of nurse practitioner students. Stay tuned next Tuesday for another episode to inspire you to be the best practitioner that you can be. Take care.
Thanks for tuning in. Don't forget to subscribe, like, and share.